Page 147, Exercise D.
But data about people's habits can also pertain to their health. So now, what healthcare professionals are looking into are uses for big data in the prevention, diagnosis, and treatment of disease. Currently, the main focus is on collecting and storing medical data that is accurate and can be trusted. But it's not an easy task, as reliable information, well, it isn't always easy to obtain. There are a couple of challenges here. One is that until recently, lots of health information has been self-reported. It's a funny thing, but patients have a tendency to be dishonest when they report their own personal health information. Psychologists say it's because they want to make themselves appear healthier than they actually are. Another issue is that even if the data is accurate, some people are reluctant to share this information. They're concerned that it won't be treated as confidential. The first problem of self-reporting can be addressed by collecting factual information only, such as weight measured in a doctor's office or blood tests done in a lab. Health monitoring gadgets are another great source of reliable data. The second issue, the one of confidential information, is being addressed by the development of increasingly effective data security technology. At the moment, the number of businesses specializing in the collection and storage of health data is growing by leaps and bounds, and hundreds of millions of dollars are being invested in this area. But we need to keep in mind that all the medical data in the world is useless unless doctors receive it in a form they can use, such as patient profiles or software to help them with decision-making. They don't have time to sift through the data and analyze it themselves. Organized information is what doctors really need. Unfortunately, comparatively little money is being spent in this area at the present time. However, one group that is working toward making big data more accessible is the Pittsburgh Health Data Alliance. They're working on profiles that collect all the information doctors need in a form that's easy to access. The problem is that the amount of data on patients is becoming overwhelming. One way to address this is by using artificial intelligence, or AI, to analyze and interpret all that data for us. AI programs are able to interpret big data to provide a diagnosis for certain diseases more quickly and effectively than doctors can by comparing symptoms or combinations of symptoms with similar cases in vast medical databases. What this could mean is catching diseases at an earlier stage, thereby saving more lives. However, let me stress that we haven't yet reached the point where a computer can replace a doctor. Even ideas suggested by AI programs can't be trusted without being tested in the real world on real people in studies supervised by doctors. And although big data will undoubtedly continue to enhance the work of medical professionals, it's still no replacement for old-fashioned medical science. But in the future, doctors will probably consult data on a patient's genetic information, lifestyle, and environmental factors to help determine the best choice of treatment. In the years to come, we'll probably see big data facilitating the development of effective treatments in various ways. For example, it'll probably help create new pharmaceutical drugs and be used to select the best participants for studies to test those drugs. In fact, certain effective drugs have already been created thanks to data-sharing arrangements between some of the world's largest drug companies. Let me highlight the guiding principles such projects follow. The more data, the better the results. It's a promising use of big data, so I'm sure we'll see a lot more collaboration in the future. Lastly, big data can help with patient follow-up care. It's been confirmed again and again that certain patients are simply reluctant or unable to follow their doctor's orders. Big data is used to determine who these patients are. And while it has traditionally been difficult to monitor patients in follow-up care, new apps keep track of where they are, whether they're taking their medicine, how well they're sleeping, and even their psychological state after they've left the hospital. I think you'll agree that big data has immense potential to greatly increase our understanding of disease and our ability to treat it. There are so many important changes just around the corner. That's what's so exciting about the medical field today. Thanks for your attention. Now I'll be happy to answer any questions you might have.